Dr. Dana Flavin, I'm so excited to have you on this segment on our little webinar series. And the thing we want to focus on, we're going to focus on toxins and cancer. First, I want people to get to know you a little bit more, so they know the type of experience that you're coming from. So tell me a little bit about your background. You're working with the FDA, all the drug companies. I mean, obviously, if we're going to read through everything, it's going to take it will take just a whole segment. But yeah, kind of some of the salient points so people understand, the wisdom that's coming from you in this area.
All right. Well, let me go back to the beginning. I what I have right now is more than 58 semesters of education, 4 disciplines, 3 doctoral disciplines, and I was the top toxicologist at FDA when I started writing my book on cancer, and I was writing it from a biochemical and sort of pharmacological standpoint. I did not realize until I got to the 3rd chapter that a nutrient could actually do something in cancer. And it angered me, I have to honestly say, because being a pharmacologist and a biochemist and all of that, and you come to a chapter on DNA synthesis, the rate limiting step in DNA synthesis, and you find out that vitamin A inhibits it. And it's like, this is impossible. This is a vitamin. A vitamin can't do anything in cancer. And when I began to see that there were pharmacological mechanisms, really drug activity of natural substances, regardless of whether it's a herb or a food or a chemical or a supplement or whatever, I looked at mechanisms. And the more I looked at mechanisms, the more I realized, wow, we're missing the boat. We're missing the boat on all of this, because there are so many ways of turning around a cancer, but it isn't one thing. And that's where we often get confused when we look at science and medicine. We think there's one treatment, there's one cure. So you think, oh, diabetes, I'll be on insulin, I'm fine, right? But it's not that case. And with cancer, there's multiple factors that need to be addressed. And when these multiple factors are addressed, one is the detox. So for getting rid of everything that is inside that tumor cell that helped cause the tumor cell in the first place. So you want to get rid of that. The second step is, what are we using for supplements or off-label drugs that are able to block pathways, block receptors, block, I call them bad guy genes, and so on and so forth. And last but not least, I found out that the emotions played a role. And I didn't know this for at least 30 years. Because I didn't want to believe it. So these are the main factors. And with my extensive education, educated in America, I was at Chicago Medical School. I was at Georgetown University. I graduated from Loyola University for undergrad in chemistry and psychology. And then Georgetown for anatomy and part 1 of the medical boards through Loyola University. And then after all of that, I then studied nutrient biochemistry in Washington, D.C. at Howard, and summa cum laude, by the way, and went to Germany, and nothing was recognized. So I was like, oh, you're kidding me. 33 semesters of education, nothing recognized except pre-med. So I wanted to finish my medical degree, and so I applied to medical school, and I was accepted into medical school. And it was about 6 years of grueling and everything in German. And then I had to, then I transferred for my last exams, which is what they call the 3rd rigorosum, to Leopold Franzen University in Austria. And it was there that I then went 2 years just doing 2 years worth of specialty exams. So I had to take the 12 major specialty exams in German, of course. The irony was I had learned medicine in Latin and Greek, right? And I'm looking at the body when they were saying blind arm, and I'm thinking, blind arm? Where the heck is that? Only to find out it's the appendix. So I had to really start from scratch to figure out where the parts of the body were in relationship to the German language versus Latin and Greek. But that only took me about 2 years, and after that, I was golden. I knew where all the parts of the body were. I knew what they were called in German, et cetera, et cetera.
So, Ricard, with oncology, I mean, how did that become your specialty? I mean, why?
Well, that's a very good question. Actually, my first success in 1993, 94 was actually in it was actually in viruses. And with the viruses, I have to shut something off in the background here. Sorry, we're hearing fish. It's one of my screen things. Anyway, when with the viruses, I was able to find out the cause of toxicity with mononucleosis, Epstein-Barr virus, and hepatosplenomegaly. And the son of the director from Essex at the time in Munich, his son was very, very ill. His spleen was ready to burst. And so he phoned me and said, I heard you might have a treatment. And I said, well, I don't know, Werner. I just published this information a few 3 months ago, a theory. And so he was an MD, PhD, also pharmacologist and physician. And I told him what I would give. And he did. And he gave it to the little boy. And then I didn't hear anything. And I said, oh my God, what happened? Did it backfire? Did the virus grow? Or what was the story here? And 4 days later, I finally phoned the mother. And I said, yeah, hi, it's Dana. What happened with the little guy, her son? And she said, oh, didn't you know my husband went and bought everything you recommended on Saturday, pushed all these capsules down his throat. And the next day he was cured. And then he flew off to America to a big meeting with Pfizer. And I said, do you mean to tell me that your son was cured in 24 hours from hepatosplenomegaly, from Epstein-Barr virus that he had for over 3 weeks? She said, yeah, and Werner flew off to America. And I'm like, oh my God. So I was speechless. And after that, the second child, another doctor's grandson, was cured in 48 hours, and his spleen was ready to burst, but his liver was toxic too. And so then the third child was from northern Germany, also a physician's son, and he was cured in 36 hours. And I remember when he phoned me and said, my son's cured. And this was after 3 days. And I said, well, how long did it take? And he said 36 hours. And I said, 36 hours? What took so long? And he was like, well, one thing came the next day. So I had all this success with viral diseases, and I published it in the New Zealand Medical Journal in 1944. It was a total breakthrough in medicine, but I don't think anybody reads the New Zealand Medical Journal, so nobody really knew about it. And I'm not, I'm kind of too busy doing research to go out and say, oh, look what I did. So who cares, right? The point is, any other child I got with Epstein-Barr virus, beautiful. We could reverse it within 24 to 48 hours. But then I had autoimmune disease patients coming to me, and I had accidentally or guided read articles on high dose of fish oil causing a decrease in the Th1 lymphocytes that create the antibodies in autoimmune disease. So the first one came to me with Graves' disease. She could hardly see because her eyes are so bugged out from the deposits behind her eyes. So I said, look, I'm going to put you on a high dose of fish oil, because nothing had worked conventionally. All the drugs that they tried, nothing worked. So I put her on the high dose of fish oil, put her on a handful of antioxidants to protect her, because when you're downregulating your Th1 lymphocytes, you are cutting down your protection against viral infections and cancer. So you must include a handful of antioxidants to block something called NF-kappa B. So I did that. So what happens? 4 weeks later, no more antibodies. And 7 weeks later, the eyes were perfect. So it hit the antibodies first. And because these were deposits behind the eye, it slowly broke them down, but she didn't need radiation therapy or anything. She could then she could see again, because she couldn't see anything. She couldn't see. Everything was double. She had a 5-year-old child. The woman was desperate. And so I thought, wow, this works. So then the next patient came along with rheumatoid arthritis, where every single thing had been given to this woman, and she's in splints. Okay. So her husband looks at me like, well, what can you do? And he said, do you take insurance? I said, no, I'm private. And he said, well, what if it doesn't work? I said, look, we'll do it like the Chinese. If it doesn't work, you don't owe me anything. And if it does work, then, you can make a donation. So he said, okay. So 4 weeks later, I get a fax from her. Now, her rheumatoid factor was 800 when she started. Okay. 4 weeks later, the rheumatoid factor is 0. And I'm like, wow, this really works. And so she paid an honorarium for me for my work. But it was just one after the other after the other. But see, cancer was the challenge. All of these were easy. I mean, it was like, oh yeah, I can do that. Like the song, I can do that. I decided that the cancer was the most intelligent of all the diseases. And I had also been working on the entire pharmacology and biochemistry of cancer since 1979. I mean, I've been looking at it forever, but it was complicated. And it was so many factors that you had to deal with, that to me, it was much more of a challenge, and an opportunity to really be able to defeat the enemy. And the enemy were many. Know thine enemy, they say in the Bible, and this is exactly what I had to do. So my most impressive patient, I had one in Ireland who I treated because they said she has no insurance. She's got a cervical cancer. She has no money. This cancer is this big, and they're not going to operate for 6 months. And she has a little boy. She's living out in the countryside. So I put together what I thought from my work and my research and so on should help her. Because actually my friends put me on a guilt trip and they said, Danny, you read all the time, do something. She has no money. She has no insurance. If you don't do something, nobody will. So I thought, oh God, okay, I better do this. So I did. And in 6 months, she had no more cancer. And I couldn't believe it. And I was also relieved because I was sending 1,000 Deutschmark a month to her to pay for electricity, to do her juicing, to pay for her NAC and her beta carotene and so on. And I learned from her about apricot seeds. And I also learned from her about SEAC tea. Okay, herbal teas like turkey rhubarb and burdock root and so on. So her cancer was gone in 6 months. That was 1992. I didn't publish it because I thought, well, this is nuts. I mean, this is so complicated that nobody understands it anyway. And so then in years later, and I was also supporting a lot of cancer patients in general. But years later, I had a patient come to me who was 39 years of age and breast cancer, brain metastases, therapied out. Herceptin inhibitor didn't work, chemo didn't work, radiation didn't work. And she was 39 years of age and they sent her home and said, you have 3 months to live. Now, lovely, lovely lady with a little 6-year-old daughter. And so what I ended up doing was saying, well, I just got all these articles from a patient about a month ago on Boswellia serrata. And I didn't know anything about Boswellia serrata at the time. And it was on gliomas. And I said, well, this isn't a glioma, but it gets into the brain. It does seem to cut down on tumor growth. So we could try it. She said, well, what are the side effects? And I said, there aren't any. So she said, okay. And I put her on a diet, got her off of red meat and got her off of sugar and white flour and so on, and cleaned up her act, got her into a lot of plant-based, etc. So I get then a visit from her 3 months later with an x-ray. And she's crying. And I'm thinking, oh God, they grew, right? And she said, no, they're all gone. I said, what do you mean they're all gone? She said, the radiologist said, I've never seen anything like this in my life. I have to tell you, I usually leave this up to the oncologist, but I've never seen this before. He said, all your tumors are gone. And I was like, well, she was in tears. I was in tears. I couldn't believe it. It really worked. And this was frankincense, Boswellia serrata. And I thought, why didn't God give me some chemical compound where I could have made millions of dollars and had a beautiful villa in southern France? Instead, I get something as old as the Bible that works so well in this lady that she does not have any cancer anymore. And that's why I started my cancer foundation of ColeMed, because I knew how important it was to get information like this out. And I felt, you know what? I have a responsibility. And this responsibility is to save lives. And it isn't just a do no harm business that I am into, it's save lives. And so this is where when I saw the results with her, I realized that, my God, we're missing the boat. We are missing the boat in conventional medicine because we are missing the pharmacological mechanisms of these things, what works, why it works, how diet plays a role, detox plays a role, and supplements play a role, etc. So this was the beginning of an odyssey that, it's like if you're guided, you're handed something, you take it and you run. You don't just say, oh, well, I don't want to have anything to do with this. This is too much work. It is a lot of work. It's 7 days a week. It's researching and researching and researching. It's every new compound, every potential supplement, I don't care if it's a veterinary drug that works in cancer based on the pharmacological mechanisms, or an off-label drug, or a natural supplement, pawpaw, for example, and things like that. I look at how it works. first and foremost, it has to show me how it works and why it works. Because if somebody says, oh, this is a great product and it's, da 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 da, and cures this and that, I said, I'm not interested. I need to know absolutely, how does it work? Is it safe? What can we use it with? Is it going to have interference with other things? So my work is 24/7, and it has been basically since 1979. So it's, nothing comes without hard work, and really, I would say, passion in what you're doing and compassion for the patients and the people who are suffering. And I myself saw my father paralyzed when I was 15, and he had a stroke. He was an oral surgeon, and he had a stroke. Of course, heavy metals, right? So high blood pressure. And 1 year later, I had grand mal seizures. 3 years later, I ended up with a breast tumor. 2 months after my best friend was killed. Emotion, right? And I didn't even realize that until about a year ago. And then when 9 months after I had the breast tumor, I broke my neck. So I'm lying in a hospital in the middle of Chicago, Mercy Hospital, with screws in my skull in a striker frame. And I can't get up. I can't go anywhere. I can't go out. It's Christmas time. And here I am, 21 years of age, basically completely incapacitated. And I thought to myself, it's only a miracle that I'm not dead, that I'm not quadriplegic. I flipped over 3 times in my MG midget and landed on my head. Now, my dad used to say I was hard-headed. Now I'm believing him very much so, because I think he was right. And that's when I finally left that hospital after 6 months in a body cast. I had given away all the roses that the chief resident had given to me. He was from India, and he was so sweet. And he gave me all these roses. And I went around to all the different hospital rooms in the neurology department and gave everyone a rose. I was on my way home. And he came into my room and said, why did you give away all my flowers? And I said, well, Krishna, I'm going home. And then I said, but they're not. And it hit me so hard. And I thought, you know what? There, but for the grace of God, go I, because these were patients with brain tumors, with Parkinson's disease, that were quadriplegic from accidents, from brain tumors and strokes. And I just, and I thought to myself, this life of mine is over. Forget theater, forget psychology, forget everything, go into science. And then when I finally got out in a body cast, and I had the body cast on for 2 months, and then I went to Loyola University and studied German, of all things, and which was very helpful, because I'm very glad I did. It's almost as if there's a plan up there, for our lives. And I look at this and I think, how did they know I was going to go to Germany? Why did they do this to me? It's like, leave me alone. Can't I just live my own life? And the answer is no, you may not. If you have something handed to you and it's a responsibility that can stop suffering and save lives, then you have a responsibility. And you have a responsibility to God or to whomever or whatever you believe in, but it's a responsibility to mankind. And that's why I'm doing and have done what I'm doing.
Well, I love that story. And I mean, what you bring into the world is just incredible. The research you're doing and looking at from all these different angles. And so in regards to then cancer, I mean, we obviously, it's a multifactorial, and we have to look at all these different things. But one area that is really important, just because we are so bombarded by toxins, both emotional and physical toxins.
True.
What role do these cellular toxicity and tissue toxicity play in cancer?
Oh, that's a very interesting point. Goes everywhere from stress, raising your cortisol levels and lowering your immune system, to contamination in our water, in our environment, in our foods, and so on, of many heavy metals, chemicals, et cetera, et cetera. And improper diet plays a major role. But this is where Stephanie Senev said from MIT, Dana, she said, sometimes I think that a tumor cell is there to protect us, because all the junk goes into the tumor. The heavy metals are in the tumor. The viruses are in the tumor. Pathogenic bacteria are in the tumor. All of these things are in the tumor. And what they're doing is they're actually altering the frequencies inside the tumor and altering what's called structured water in tumors. structured water is a hexagonal form of water that when it is raining in the winter and the rain is coming down, why does it turn into a snowflake with 6 sides to it? Because it's hexagonal water, and that's the purest form of water there is. Okay, that goes back to Schauberger and his research years ago. So what I found from the research on Professor John's book on hexagonal water was that in tumor cells, it was only 20% structured water, whereas a normal cell had 80%. So what we found out was that there was a complete change in the tumor cells in relationship to just the water structure. And the Helmholtz Institute said, water is what's responsible for stabilizing our DNA. Now, when our water is unstable, like it is in tumor cells, the DNA is unstable. So what does it do? It replicates. You see?
It was interesting. I was chatting with Professor Gerald Pollack yesterday.
Jerry, he's a doll. Yes,
yeah.
yes,
and,
yes. I like him a lot.
The easy or fourth phase of water, being then the structured water, and
right.
what we can do in order to be able to kind of recharge, to bring back some of that structure. Exactly. There it is.
Thank you, Jerry, for your genius. He's brilliant.
He is brilliant. So so it almost sounds like then tumors are like a survival mechanism where we are then gathering all the toxins, the pathogens, and the key then to be able to dissolve tumors would make sense would be to clear out these toxins so that the tumor does not fill that role anymore.
Right. Interesting from Jerry's work on easy water and all of that business, showing that when he takes a hydrophilic surface and puts an electrode next to it in the water, and then puts another electrode on the other side where it's an OH, where it's a negative, and he can light up a light bulb. So guess what we have on our DNA? We have a hydrophilic surface on our DNA. So it's pulling in those hydrogens. It's quite fascinating. Now, when that DNA is screwed up with frequency changes and so on, you don't have that anymore. And this is where all of these contaminants will interfere with the frequencies, will interfere with the ability to structure water, because your chromosomes can structure water if they're healthy. Okay. And if you don't have all these contaminants around, but Professor John showed that things like aluminum will destructure. I think I lost you here a second. I have to put you on low power mode. I hope I don't lose you soon, because I can't plug in a battery on this without taking out the Zoom. I'm so sorry. Listen, cancer is easy to cure, but how to fix these stupid iPhones and computers is for me a nightmare. But anyway, we are body electric, and that's what Becker wrote. And I see this on the surface of the membranes, and I see this on the healthy cells, but obviously it's not in the tumor cells. So our tumor cells are like shutting off the battery. Mm-hmm. You don't have that activity anymore. You don't have that healing property either. And if you don't get the junk, and I'm sorry to be so broad on this, if you don't get the junk, the heavy metals, the chemicals, the pathogens, the viruses, and et cetera, out of those tumors, they're either going to just come back again, or you're never going to get rid of that tumor. And that's why blasting the hell out of a tumor is really not the wisest thing to do without starting with a detox first. So that's why I tried. And the thing is, a lot of people say, oh, well, Dana, you're in complementary alternative medicine and integrative medicine and so on, and you're a professor teaching this stuff. And I said, look, I don't care if we use a chemical, radiation, surgery. It all has to work together, but you cannot just choose one. It doesn't work that way. It's a combination of things. And so if some people do, out of panic, insist that they have chemo, you can work with it. But if they don't want chemo, you can work without it. So this is where I just figured, as my father used to say, there's more than one way to skin a cat. And so I just say, you know what? We'll do whatever we can, covering all bases. And that's basically what I do. And this is something where I also look up anything that is recommended to patients, especially some of these companies that come in and say, oh yeah, this cured this and this cured that. And then I look it up and I think, wait a minute, they've got the wrong theory on this. that works for maybe mitochondrial problems, but it doesn't work in cancer. So this is where you really have to know your stuff, and you have to know your pharmacology, and you have to know the pathology of the disease. So, where something can help in one disease, like chronic fatigue or something, it may be a negative in another disease. And that's where it's really important to be able to weigh out the differences on these and to see, okay, what are we dealing with? And where do we go first? What's the best, safest, and most practical way to stop or reverse this disease?
I mean, it seems to me, I mean, in addition to then obviously shutting down the drivers of the disease, and there are many different things that we can use for that, and then also then supporting the apoptosis, things like LDN and DCA and those type of things. But then to clean up the environment, to really make sure that as we are then blasting these tumors, that we're not just spewing toxins all over the body, which will then create a reason to create tumors elsewhere because the body is wanting to contain these toxins.
It usually does. That's why we get metastases.
Yeah. So what in your mind, I mean, for detoxification, are there some strategies that you utilize to initiate that process?
Well, one of the most important things, which sounds absolutely silly, they say in German Alben, is that you have to have the proper body pH. Now, that's a really basic thing. We're going back to the beginning of chemistry, the beginning of the studies in chemistry. If your pH is not in the right place, if you're acidic, you get inflammation. If you get inflammation, you can stimulate tumor growth, you can stimulate pain, et cetera, et cetera. So if you've got arthritis and you're acidic, you're going to have pain. If you have cancer and you're acidic, it helps the tumors to grow. It lowers your immune system. So these are the things that basically that goes with diet. That's where you get off of the sugars, you get off the white flours and things like that. You shift that body pH. And that's a very, very, very important point. This is something, and if, for example, people that are overweight, their fat cells will release inflammatory parameters. Okay, they set off all sorts of prostaglandins and everything else from the fat cells. So they've got to lose weight, and they've got to exercise. And this is something where you can't cure or reverse a cancer if you don't self-discipline. And as much as we'd all like to just say, oh, doc, you do it, I don't want to bother. Just give me an injection or give me a pill and let it all go away. So I don't have to change my lifestyle. So I don't have to relax. So I don't have to exercise. So I don't have to watch what I eat. So I can just continue on doing everything that I've done wrong for all this time, and bingo. And it just doesn't work that way. It's too complicated.
Yeah. And with pH, I mean, so we have all these toxins, they're acidic in nature, and if you start to move them then for elimination, I mean, the body is not going to release the pH within the blood is such a controlled mechanism, and that's life and death. So if you would then release a lot of these acidic waste, when you are acidic already, you are putting yourself more at risk for harm, and the body is not going to let that happen. So in order to be able for the body to feel secure to dump these acidic toxins, we need to have then an alkaline body, so that it can handle the removal of these acidic toxins.
Right. You can't just go and take something that's going to, quote, alkalinize your body and think that. The thing is, if you do blood pH, it's always going to be around 7.2 to 7.4. But if you do urine and saliva, that really tells you what's going on, because your blood is going to balance itself out so you don't drop dead. Let's face it. And this is something where, this is why I have my patients test with a litmus paper in the morning and at night for saliva and for urine to see what's going on here. And I've never met a cancer patient that was not acidic. Mm-hmm. They're all acidic. And once you get them into alkaline, changing their diet, putting them on natural foods, on plant foods, and so on. I mean, I have to say, there's a lot of information out there that says by eating alkaline foods, we can shift our body pH. Well, it isn't just that. That's fabulous. But a lot of the alkaline foods have inhibitors of cancer in them. They have things like quercetin in it. I mean, apples, quercetin. Quercetin blocks epidermal growth factor. Now, there's a lot of new drugs for epidermal growth factor, but quercetin will block it. And quercetin will block something called fibroblastic growth factor. That's another growth factor around tumor cells. So you've got these mechanisms also in these natural foods and these fresh fruits and vegetables, organic, of course. You don't want any more chemicals in there. We've got enough going on. But this is where the water has to be pure, the food needs to be organic, and you need to go really plant-based. Not 100. I have disagreements with a few colleagues. No red meat, no beef, no pork. Okay, why? Arginine and iron will stimulate tumor growth, so we just stay away from those. But some of my colleagues say no fish. I'm not a purist. Okay, sorry, God, but I'm not a purist. Sometimes I will say, a little wild caught salmon might be a good idea. And some people need a warm meal. They need something that is that's higher protein, and also it's omega-3s anyway. So I don't worry about that too much. But basically, to keep down and avoid any of the white flour, the wheat flour, the red meats. Okay, and one of my colleagues, the late Dr. Livingston, used to allow lamb once a month, and that's a very interesting point, because even the Buddhists allow lamb sometimes, and I was surprised. I didn't think Buddhists had anything to do with any living creature, but it seems some do. Anyway, lamb does not appear to have the negative aspects of beef or pork. So this is something I do allow if their RBCs are down and their ferritin is not elevated, then I will allow them to have a little bit of a lamb maybe once a month. That's about it. But usually they don't need more than that, because there are many plants that are full of protein. Chickpeas, for example, or garbanzo beans, they're full of protein. Most of the lentils are excellent. They alkalinize. They're high in protein, but not a protein that will stimulate tumor growth. And that's kind of the interesting point. This is why when I look at the different diets and I think to myself, an interesting one is basically the Indian diet, because they have so many spices. And in fact, every morning in my tea, I have cardamom and ginger. And yesterday I was just reading about gingerol. Gingerol is in ginger, which has a wonderful anti-cancer effect by downregulating ferritin. And I thought, oh, that's cool. I throw it into my juicing for carrot juice with a little bit of little bit of ginger and celery stalk and red beet, because they're all anti-cancer. It also brings the potassium back too, so it's very helpful for patients. So this is something where the juicing works, but not Gerson's. Unfortunately, Gerson's pure juicing is, I would say, something of the past, because our foods do not have the nutrients in it anymore that they used to. And that's a real pity, but that has to do with destruction of the soil. We have a lot of aluminum, or as they say in England, aluminium in the soil, from nano aluminium that is in rainwater and in the soil, period. And it's changing the pH of the soil too. So we need to detox. All of us, you, me, it doesn't matter whether you have cancer or not. I have everyone detoxing except my stubborn daughter, who is a magna cum laude from the German Cancer Research Center, who is not quite convinced 100% that mom's right. And I said, okay, I just I'll give you time, but listen to me. And it's funny how the last people in our lives that will listen to us is a family member, right?
Isn't that funny?
Right.
How that is, yeah.
Yeah, I don't know. You can't be a prophet in your own backyard. So what can I say? However, she's seen me cure or help cure anyway. God cures, I just help. Breast cancer stage 4, colon cancer stage 4, lung cancer stage 4. And so she actually says to when one of her girlfriend's parents or family member have a cancer, oh, you got to talk to my mom. I got to talk to my mom. Oh, thank you. Finally, I'm getting something recognition for all my work. But it's a very interesting thing because she is a PhD in cancer research, and I go on mechanisms, and she's so specialized. She said she did not want to be a physician, and I said, why not? She said, because you work too hard. And I said, but I love what I do.
Yeah.
I save lives.
Yeah.
And what could be more rewarding than that?
Yeah.
I mean, there really isn't anything. It's like a purpose to your complete existence on this earth.
Mm-hmm.
It's like, okay, I'm paying back the universe for my broken neck, my grand mal seizures, my tumor. I'm paying them back for letting me live and letting me to be able to go on to do something for mankind. So I swear they literally hit you over the head in life, whoever is up there guiding us, to say, okay, you're going to do this, or you're going to go in this direction. And I've seen this in patients too, patients that have horrible emotional problems, et cetera, and then they have cancer and they're therapists. And I tell them, you know what? You're first. You need the therapy first. And that's why you are learning this to teach other people. And that's what they do. They teach other people. So they end up saving lives from what they had. And I said, that's what it is. It's all a chain reaction. If you get something and you help yourself, then help somebody else.
I agree. And with, like we're talking about detoxification, it's not just chemicals, heavy metals, pathogens. It is like we're talking about the emotions, and the key to detoxify that in relation to cancer is huge.
Yeah, I wrote a poem on that, actually. And it basically said, I read through Plato, through Freud, and then Kant, seeking an answer for something I want. Why can they not tell me what I want to know? What is an emotion and where does it go? If we can't feel it, nor touch it, nor see, then surely it isn't in reality. Then why do we laugh and why do we cry? A smile and hello, a tear and goodbye. What is it in us that makes us to care, give us a hope, or cause us despair? Perhaps you can tell me. I so want to know, what is an emotion and where does it go? Well, and I thought, you know what? We're doing everything based on facts, data, research. For example, the cancer research goes in vitro to little cells that are never going to be exposed to garbage that we're exposed to. Okay. And they say, oh, it cures it. And then I look at the fantastic work of Judah Folkman, reversing all the tumors in his mice. Mm-hmm. When I was up at Harvard visiting for a meeting, and Judah said, if you were a mouse, I could cure you. And it broke my heart because the man was brilliant, exceptional work, but it was a mouse. It did not have the emotional problems. It did not have the contamination. It did not have all of the factors that we as human beings have that actually introduce cancer into our bodies and allow it to grow. So for the mice to reverse a cancer, great. But as soon as they started using it in the clinics, it didn't work. And these were these VEGF inhibitors. And the thing is, I thought to myself, all the research in the world, we need to see the whole body. We need to see the whole human being. We need to see the chemical contamination, the viral contamination, the emotional contamination. I've had 1 or 2 patients that I lost. Why? Because they had abusive partners. And they could not get away from their abusive partner. And I am not kidding. When I've seen this only 3 times, and it broke my heart because they were dependent on this person financially. They had children, they couldn't leave, and they died. And I thought to myself, I do believe we can die of a broken heart too. And this is something where that's something where I wish I could just take these people and bring them somewhere else and help to bring them out of this. And why they have to have this karma, I don't know. But I can tell you that's really was a heavy lesson to me, that the emotional aspect of cancer is so much more than we ever realized. And this is something that we absolutely must work on also. That's why I like some of the work of Joe Dispenza and Bruce Lipton and so on, and talking about our environment and the emotions and stuff. And this is something where I hope I'm not going to lose you here because I've got a low battery. Anyway, this is something where the people have to do it. They really do. It's hard to dig into your past to find out what hurt you. what was it that hurt you so much that you don't want to live? And I had one man that had prostate cancer with metastases everywhere. I got rid of them all. It was fantastic. And then he quit everything. And then I found out from a naturopath that was working with him that he had been abused as a child. And because he was so abused, he did not want to live. So he quit everything. All the tumors were gone. They were all gone. And he quit absolutely everything. And his emotions just pushed him back into cancer. And this is something that I almost refuse to believe it, because I'm so stubborn, and because I've done so much research, and because I know that it works. And then when I find out, wait a minute, you quit everything? Do you not want to live? This is the thing that's really hard for me as a physician to comprehend, that somebody doesn't want to live. So I think for some people, I know that Dr. Scheller said to me, the late Dr. Scheller from the Leonardi Clinic, we collaborate on a lot of patients. And he said, sometimes I think cancer is a legal suicide. And I said, oh, Albert, you can't mean that. And he goes, no, some people are so distraught and so emotionally destroyed that they really do not want to live. And it's an excuse not to live. And I was horrified. But the more I know about cancer in patients, every once in a while, and thank God it's not that common, but every once in a while you get someone that just does not want to live. And what do you do? What do we do? That's why I send them off to Joe Dispenza. Please, Joe, help us. You're so brilliant, and you've done so much and helped so many people that very often by visualizing your tumor going away, you can actually get rid of the tumor. And that's physics. That is quantum physics that is actually going into that tumor and changing its whole structure. And I'm doing more research on this, looking at it now, thinking, wow, why didn't I know about quantum physics 30, 40 years ago? Well, nobody did. Even Einstein said it was spooky. And he's right. It's spooky. It's spooky that you can actually visualize your tumor going away, and it helps, and I'm amazed.
And with that also, I mean, as you're visualizing the tumor going away, you're also connecting with the energy that is consisting of that, that tumor is consisting of, so that you're processing and clearing the emotions, the traumas, the toxin, the energy frequency of the toxins, all of these things. Yeah, you're dealing with that at that same time.
Right. It's like, I love my body. I love you, tumor. You can go now. Thank you for being there to wall up all the bad guys. Now we're going to get rid of all the bad guys so that you don't have to stay anymore, but appreciate your efforts.
Yeah, exactly.
And now you can leave. It's like giving it permission to leave.
Mm-hmm. Yeah, it's worked hard for you for all this time, and now it's fulfilled its purpose, and now it can go.
Right. Who'd ever think?
Yeah.
Talking to your tumor. Yeah. Yes.
I love it. Well, Dr. Dana Flavin, I thank you so much for everything you're doing, for all your wisdom, for all the lives that you're saving, for your dedication, for your research. Thank you so much.
Well, let us hope in the future that we can get enough funding with the foundation with Colmed to get a book out for people. I've been doing videos, and that's very helpful, but we really need to get the book out. But that takes editors, that takes time, and that takes effort. And this is the hard part. And secondary, I am looking at a frequency that causes tumor cells to turn into normal cells. And this is something that I have a few colleagues looking into. I'm hoping we can get what we need. I know how to make it. I know I wasn't supposed to know this from let me put it this way, from the military, that it actually worked through frequencies. Harvard's working on it, but they're not working on frequencies. They're only working on structures. Mm-hmm. And Northwestern University was working on it too. And when I told my daughter about it, she said, yeah, sure, Mom. And then about a year later, she said, Mom, there's a lady here from Northwestern University, and she's got this extracellular matrix material that causes tumor cells to turn into normal cells. And I said, finally, will you please get me the references? So she got me all the references, and then I can read up on it. So now we're trying to get this made. I had wanted to work with Luc Montagnier on this, and I thought to myself, I'm skeptical on the Rife machine and Spooky 2 and all that, but they're really good for a lot of different parasites and stuff. But if we can program this frequency into there, then we've got something really exciting. So say some prayers. Hopefully we'll get some additional funding and be able to get this done. And I just figured that, you know what, that there's only one thing that I'm interested in, and that is to help patients to go into remission. And I don't care if we do it through physics. I don't care if we do it through biochemistry, pharmacology. Very often we have to do it through all of them. And then prayer, because that's what works.
Yes. From my mouth to God's ears.
Amen. Thank you.
Yes. Thank you
Absolutely.
so much.